All right, folks, the live stream is working again. My apologies again for the crash out. We are going to get started. Zelly is going to read back the last line or two that before the briefing crashed, and then we will get back into it. We will obviously extend past 11 o'clock to make up for the missed time. Thank you very much. And Zelly, please take the floor.
A partir de hoy, la ciudad de Filadelfia y nuestros socios han administrado más de 2 millones de dosis de la vacuna COVID. En los últimos 9 meses, miles de personas, muchas en el Departamento de Salud, pero también personas que trabajan en hospitales, centros de salud calificados a nivel federal, farmacias, el consorcio COVID-19 de Médicos Negros, FEMA y más, han perseverado y nos han llevado a este punto. A través de tormentas de nieve, olas de calor y tornados, durante los 18 meses más difíciles que cualquiera de nosotros ha trabajado, hicimos algo que nadie pensó que fuera posible: 2 millones de vacunas en 9 meses. No sé si alguna vez podré expresar suficiente gratitud a todos los que han contribuido a este esfuerzo. Tampoco sé si alguna vez podremos agradecer plenamente a los habitantes de Filadelfia que han usado su máscara, se han distanciado socialmente, se han quedado en casa cuando estaban enfermos y, lo que es más importante, han sido vacunados. Este ha sido un momento horrible, pero ver a esta ciudad unirse y literalmente arremangarse para salvar vidas es algo de lo que todos deberíamos estar orgullosos. A continuación, quiero hablar sobre las escuelas y COVID. Hoy estamos publicando una nueva guía sobre la detección en las escuelas y cuando las escuelas deben pausar el aprendizaje en persona debido a COVID en nuestro sitio de web. Como recordatorio, las escuelas tienen una serie de medidas de seguridad para frenar la propagación y proteger a los que son demasiado jóvenes para ser vacunados. Primero, todos en un edificio escolar deben estar enmascarados, excepto cuando están comiendo o bebiendo. Las escuelas deben permitir el distanciamiento físico donde puedan, proporcionar oportunidades para una buena higiene de manos y proporcionar un sitio limpio. Recomendamos encarecidamente que todas las personas que sean elegibles también estén completamente vacunadas. Y finalmente, todas las escuelas en Filadelfia tienen que seguir nuestro guía sobre el rastreo de contactos, detección y cuarentena. Hemos cambiado nuestras recomendaciones sobre las pruebas de detección y estamos pidiendo que las escuelas sigan la guía de la CDC para realizar pruebas de detección semanales para estudiantes no vacunados siempre que sea posible. Esto es consistente con la recomendación de la CDC de que las pruebas de detección deben ofrecerse a los estudiantes que no han sido completamente vacunados, cuando la transmisión comunitaria está en niveles moderados, sustanciales o altos, como los de Filadelfia. Las pruebas de detección también deben ofrecerse a todos los maestros y personal que no han sido completamente vacunados, sin importar cuánta transmisión comunitaria haya. También estamos incluyendo la prueba para quedarse como una opción para las escuelas. Esto significa que las escuelas podrían permitir contactos cercanos de alguien que da positivo en la escuela para evitar la necesidad de la cuarentena. Sí, y esto es un gran sí. La escuela puede ofrecer pruebas rápidas, frecuentes, y el niño da negativo cada 2 días durante una semana. A continuación, nuestras recomendaciones sobre cuándo las escuelas deben pausar el aprendizaje en persona también ha cambiado un poco. Primero, y lo más importante, cualquier persona que tenga síntomas de COVID o no se sienta bien debe quedarse en casa y hacerse la prueba. Cuando 1 o 2 personas en una escuela dan positivo, sus contactos cercanos deben ponerse en cuarentena hasta por 10 días si no están vacunados. Si están vacunados, no necesitan ponerse en cuarentena, pero deben hacerse la prueba de 3 a 5 días después de esa exposición, siempre y cuando no tengan ningún síntoma y deben asegurarse de enmascararse en público. Si 3 personas en una clase dan positivo, esa clase debe pausar el aprendizaje en persona durante 10 días. Si esos 3 casos positivos están en diferentes grados o aulas, la escuela debe tratarlos como casos individuales y simplemente poner en cuarentena a sus contactos cercanos. En el caso de que 6 o más personas den positivo en un grado, la escuela debe llamar al Departamento de Salud inmediato y discutir la necesidad de pausar el aprendizaje en persona para todo el grado. Si 3 o más grados están en pausa o más del 3% de toda la comunidad escolar da positivo, la escuela debe llamar al Departamento de Salud de inmediato y discutir la necesidad de pausar el aprendizaje en persona para toda la escuela. Esta nueva guía es menos estricta que nuestra guía anterior porque hemos visto que nuestras otras medidas de seguridad han tenido éxito en la contención de la propagación. Creemos que es posible prevenir una propagación más amplia de COVID en las escuelas y mantener a los niños en la escuela. Esto no significa que no habrá COVID en nuestras escuelas. La transmisión comunitaria es lo suficientemente alta como para que algunos estudiantes, personal y profesores estén expuestos en casa o fuera de la escuela y puedan traerla. Pero con la detección diaria de síntomas y el enmascaramiento al 100%, el rastreo de contactos y las vacunas, podemos evitar que esa persona propague COVID a otras personas mientras está en la escuela. Al igual que con toda nuestra orientación, continuaremos monitorando la situación en nuestras escuelas y podemos cambiar esta guía nuevamente si es necesario. Aparte de las escuelas, quería señalar como recordatorio que todos los trabajadores de salud de Filadelfia deben vacunarse antes del 15 de octubre. Eso significa que si recibe su primera dosis de Pfizer para este viernes, aún puede obtener su segunda dosis antes de esa fecha. También puede obtener la dosis única de Johnson Johnson y cumplir con esa fecha. El tiempo se está acabando, así que encuentre un sitio de vacunación más cercano hoy visitando a phila.gov/vaccine. Para concluir, si desea obtener más información, visite nuestro sitio web en phila.gov/COVID. Si tienes preguntas, llama a nuestro centro de llamadas COVID al 215-685-5488. Thank you.
Thank you very much, Zelly, and thank you all for your patience. We're going to jump right into Q&A. Same rules apply as usual. First up, we're going to go to Brandon Hudson from Channel 10. Go ahead, Brandon.
Hey, good morning. First, I just wanted to ask about how the booster shots may, affect, what the protocol is for getting kids vaccinated, as well as the vaccinations being on their way to being approved for kids who are ages 5 to 11.
So they're really separate initiatives. The booster shots, we will be promoting and trying to get to as many people as possible in the city just as soon as we have the final word from ACIP, which may come out either today or tomorrow. We're waiting, we can't start until we find out exactly what the groups are and until it's approved. Similarly, with vaccines for children, we're waiting for FDA approval. So, eagerly looking to start. The providers for kids will be a little bit different because pediatricians and primary care offices that are enrolled in vaccines for children, the family physicians and internists could be part of boosters if they're enrolled, but pediatricians obviously couldn't. So, we're working on all of that planning all at once with a certain amount of unknowns in that process.
And then the second thing is just what prompted the change to what prompted the motivation to make these changes? Was it seeing an increase in positive tests in school? Was it seeing a decrease? Was it maybe kind of lessening the restrictions because they may have been too strict?
It was looking at what we were doing in comparison to other places, looking at the number of schools we were ending up closing, and seeing the reality on the ground of what the cases are. So, for example, you could have a few households of siblings who test positive. That doesn't really mean that there's in-school spread. So it's not really a reason you would need to close a school, but according to our previous criteria, you might have had to. So, I think you've watched us before and need to change guidance as we look at how things roll out and as additional research shows that there's better ways to do things. And we are going to continue to do that. We're keeping the school district, of course, very much in the loop on that.
All right. Thank you. Thank you, Dr. Bedigal.
Thank you very much, Brandon. Next up, we're going to go to Jeff Cole from Fox 29. Go ahead, Jeff.
Yeah, thanks, folks. Doctor, how is this less strict specifically in terms of the closure of schools than your prior criteria, if you would?
So that it's really in the numbers that would require a closure. And I think we have Gail Carter, I can't speak this morning, Gail Carter Hamilton, the head of our schools team here, and Gail can probably give more specifics on that.
Good morning, Jeff. Yes. So previously we had a blanket 6 cases within a school would prompt a closure. But what we were finding was that didn't fit all landscapes for every school. So allowing a threshold that allows for percentages gives us a little bit more opportunity to individualize case counts at particular schools, thus lessening the incidence for closures.
So forgive me for not being as good on math as I should be and how this figures out. So now how would it work? Let's say you did get 6 positive tests in a school now. How would you calculate that now and make a decision?
So we would have to have the denominator of the school, which would be the total number in attendance, including staff. The other thing we would look at is where are the cases centralized? Are they central in a particular grade, or are they spread out across the school? Those 2 things would really determine the need for closure. If there was an increase, if you will, for a larger amount of the percentage, and it was reaching a threshold, say, of 3%, that would prompt a closure. Whereby in the past, if there were 1 person in a cohort, we would have initiated a closure within the cohort. That is not the same now. Contact tracing works, so this will allow us to be able to really take an ingrained look at school closures.
One more, if I could, with you. Thank you. So are there schools that are paused now that would not have been paused under what you're doing now?
Potentially, yes. I can't really speak to all of them on this conference, but we can gather some of that information and get back to you.
Thanks. Can I just go back to the acting commissioner for just 1 minute?
Make it quick, Jeff. We got a lot of people and running out of time.
Real quickly, the importance, in your view, of keeping kids in school.
Sorry.
Sorry about that.
Yeah, from a health provider's perspective or policy person's perspective, what's the importance in your view of changing guidance to keep kids in school? What's the importance of that?
It's huge, and I think we've heard that from the American Academy of Pediatrics and from many other organizations of providers who specialize in kids. The mental health benefits of kids interacting with other kids in person are huge, and of course, kids learning in person is just going to be much more effective. I don't want to pretend that this isn't hard. It is, but we need our kids learning in person.
Thank you.
Thank you very much, Jeff. Next, we're going to go to Jack Tomzik from the Metro. Go ahead, Jack.
Thank you. Dr. Bedigal, regarding the weekly testing, have you consulted with the school district about this, and are they planning to go forward with weekly testing of all students who aren't vaccinated?
So we've let the district know that we're changing our recommendation. As you'll see in the guidance as posted, it is where possible. And I know that the district will do everything they can to carry out this recommendation. The exact timing of that, I have to defer to the district on. Okay.
And will there be, well, how many schools are paused right now?
I'm going to defer to Gail on that. Do you have the exact number?
I believe we're up to 5 now, but this is a rolling thing, so there could have been more that are on the radar for this morning. We can get particulars back to Jim Garrow, who can get back to you on the actual numbers.
And with the new guidance regarding the weekly testing, Dr. Bedigal, are you concerned that the testing kits may run short?
So yes, I mean, again, that where possible is an important caveat, but I know that the Biden administration is doing everything they can to increase the number of tests. There's funding for tests for the school district and for other schools. So we want to make this as possible as we can. But I think the first step was getting to that recommendation. And then, the implementation is work. And getting there will involve all of these pieces, not just the tests themselves, but staff to do it.
Right. Thank you.
Thank you very much, Jack. Next up, we'll go to Dave Melandra from Philly Sports Blitz. Go ahead, David.
Dr. Bedigal, I got a couple questions for you. One, this past weekend, the Eagles had their home opener with fans in the stadium for the first time since 2019. Has there been any fallout from that, like say any contact tracing from it?
Not that I'm aware of. That doesn't mean that there couldn't be cases resulting from it, but I have not heard of anything to this point.
And in a couple of weeks, the Flyers and Sixers are going to be beginning their season inside the Wells Fargo Center. Will masking be required?
Yes. Anytime people gather inside, they should be masked unless they're in their own homes and they're just with their own family.
All right, thank you.
Thank you very much, David. Next up, we're going to go to, I believe this is Dale Mazzacappa from Chalkbeat. Go ahead, Dale.
Hi. Yeah, I think my question was answered. I'm still trying to determine exactly the difference in the recommendation relating to testing of asymptomatic of all students who aren't vaccinated. First of all, how does the district know who's vaccinated and who isn't? I mean, other than the fact that they're under 12. So I'm just wondering. It seems like you're saying that they can go ahead and do what they've been doing now because the where possible gives them an out. I'm just trying to get a sense of how you're trying to, what you're trying to push them to do that they aren't doing now.
Yeah, I mean, this is a difference, and it's a recommendation for a weekly screening testing for any unvaccinated child. That would be all children under 12. The district does have access to the vaccine registry in terms of determining the vaccine status of kids 12 and over.
Okay, so you're expecting them to do more testing than they're doing now?
That's correct.
Okay, thank you.
Thank you very much, Dale. Next up, we'll go to Maddie Hanna from the Inquirer. Go ahead, Maddie.
Hi, thank you. Yes, my question is just what these new guidelines are based on in terms of, I'm interested in 3% of cases or 3% of a school's community testing positive for incident, how that threshold was arrived at for a possible closure recommendation.
Yeah, so all of this is, essentially a work in progress as science develops. So these are our best estimates based on the evidence from around the country, around the world, in terms of what constitutes enough spread in school that we really have to pause for a time. And again, you may see these numbers change over time. But this is our infectious disease specialists and public health specialists putting their heads together and coming up with their best strategy for the evidence we have right now.
Maddie, you have another question?
Nope, that's good. Thank you.
Thank you very much. Next up, we'll go to Mike D'Onofrio. Mike, you're on the deck.
Hey, thanks. I don't know if somebody already asked this, but can someone tell me how many schools have been shut down due to COVID and then how many are currently shut down?
Mike, I can follow up with you on that. I'm getting that to another reporter.
Okay, thanks.
All right, with that, we will move on to Pat Loeb from KYW. Go ahead, Pat. You should be able to unmute.
Yeah, okay, thanks. Dr. Bedigal, do you have any theories about why the numbers of new cases aren't continuing to go down, why they are still hanging around 280?
I'm actually frankly happy that they haven't gone up further, given that we've opened schools. Because, opening schools means that we are mingling children who are unvaccinated. And it means that we are also testing much more. We also have colleges and universities starting. So the fact that we're still pretty plateaued, I think, is very good. I think reflects our relatively high vaccination rate, but there's no guarantee that we'll stay here. As schools continue, there could be a climb in cases. We just haven't yet seen, it's mostly wiggle at this stage.
Okay, thank you.
Thank you very much, Pat. Finally, we'll go to Zimina Conde, WHYY. Go ahead. You should be able to unmute now.
Great. I just wanted to ask, I'm not sure if this was already answered. How big of an operation will it be to test all the unvaccinated children? Do we have a number of kids this would affect?
I don't have an exact number. It is every child under 12 who's in school in Philadelphia. It is a lot of people and it takes significant time. This is a large operation.
Do we have a sense as to how long it'll be until we have like protocols rolled out for testing?
Well, the protocol is for a weekly screening test, but actually putting that into place in the school district and all the other schools in Philadelphia, I'm assuming will take them some time. There is an RFP for an outside testing vendor for schools other than the school district that was posted, and I believe awards will be announced soon. So that will assist the other schools to have testing in place. But all of this is going to be a work in progress over the next few weeks.
Gotcha. And then the last thing, Jim, could I also get the number of schools that have been shut down because of COVID cases?
Sure thing. I'll send that along to you.
Thank you.
All right. And then it looks like Maddie Hannah's got one quick question. Go ahead, Maddie.
Hi, yes, I forgot to ask earlier. I'm wondering with either the schools that have been closed so far or in other schools, if to what extent you've seen any actual transmission of cases in school settings at this point, or if you've been able to determine to what extent it's transmitting in the school environment this fall.
Yeah, do you want to speak to that?
Yes, thank you for your question. We still, as of last year and this year, are seeing very low transmission that would be considered in-school transmission. Much of the prompting of schools closing this fall were just because of the sheer numbers that were outside of our old threshold of 6 or more across grades. Thank you for the question.
Wonderful. Thank you all very much for your question, your time, and your patience with our technical difficulties. If you do have any other questions, please feel free to reach out to us and we'll get back to you. Look forward to seeing